And we are broadcasting and recording.
Thank you. Welcome, everybody that's joining us here today to our Washington Academy of General Dentistry Stay Home, Stay Healthy CE series. We appreciate you spending time with us. We have a great lineup of speakers today. So we have probably, if I calculate it, probably 4 hours of CE for you today. So we're going to start out with Mr. Ali Oromchian from HR for Health. And then Dr. Yassine, his dental implant study club will follow at noon. And at 2:30 today, we have Dr. John Nosty that's going to present on prep and no prep veneers. So really a good lineup. For those of you that haven't joined us before, for CE credit, we will be sending you CE credit within the next day or 2 days to the email address you registered at. AGD members, there's no need to submit your CE to the Academy of General Dentistry. We will do that for you. We just ask you to wait 2 to 4 weeks to see that on your transcript. The AGD is backed up right now with getting all that CE updated on transcripts. So don't expect to see it right away. We'd like to thank all our co-sponsors here today. The Washington Academy of General Dentistry, the University of Washington School of Dentistry Continuing Education Department, the Canadian Academy of Restorative Dentists and Prosthodontics, and we'd like to thank Comet USA for their sponsorship, Seattle King County Dental Society, Pierce County Dental Society, Snohomish County Dental Society, and Patterson Dental. We'd also like to thank our student chapter, the University of Washington School of Dentistry's AGD student chapter. Thank you for joining us as well. For those of you that have questions, whether they can, you can review the webinars that have already aired. Yes, you can. Those are available on YouTube at Washington Academy of General Dentistry. If for some reason you have troubles getting to those links, please go to our webpage, www.washingtonagd.org, and you should be able to use the link there for YouTube and get to those webinars. Today, if you have a question, please put it in the Q&A section, not the chat section. The Q&A section will allow us to weed through those questions to kind of group them together so we don't ask the same question over and over of our speaker. So we have almost 500 people registered for today. I know it's right at 10 o'clock right now. We're going to just wait a couple of minutes here before we get started with our speaker. And yes, we'll go through some of the housekeeping aspects here again. What you're seeing on your screen right now is a PowerPoint presentation with some of our past speakers of this week and our upcoming speakers. If you want to register for any of those webinars, please, you can use the QR codes that are flashing up on your screen. At the end of our presentation today, we will throw this PowerPoint back up so you can use those QR codes, or you can always just go to washingtonagd.org and you should see these CE webinars listed. Just a reminder, all of the CE is being brought to you free. All of our speakers have graciously donated their time, their expertise. We really appreciate that. We could not do this without them. Thank you to our Executive Director, Valerie Bartoli, and to our panelist, Dr. Gary Hayamoto, for helping moderate these webinars as well. We're trying to put as much content out to you on a daily basis. We're striving for 2 or 3 webinars a day, and please let your friends, your colleagues know that this CE is available. They do not need to be an AGD member. Students and young dentists, keep in mind, being a AGD member, there's a real low bar to become an AGD member. Students, it's $21 a year to be an AGD member, and once you graduate dental school, the first year is $78. Just huge value. The AGD is really focused on bringing quality education to general dentists and serving those constituents that are part of the AGD. And speaking of our constituents, want to welcome again the Texas AGD. I see the Dallas Academy of General Dentistry posted on Facebook regarding our Washington Academy of General Dentistry Stay Home, Stay Healthy CE series. We appreciate it. Welcome to California. Welcome to Arkansas. I believe Nebraska AGD is joining us as well. And again, to all our friends in Canada via the Canadian Academy of Restorative Dentistry and Prosthodontics, welcome. I wore my tie. So it gives me a great pleasure to introduce Ali Oromchian. For one reason, he's a hockey fan, and I'm a big hockey fan as well. I hear he's a Penguins fan, so that's I like Sydney. Yeah. But Ali is one of the nation's leading dental lawyers on topics relevant to dentists. His clients seek his advice on practice, acquisitions and sales, creations of corporations and partnerships, associate contracts, employment law matters, office leasing, and state board defense. He's the founder of Dental and Medical Counsel PC law firm, which is regarded as one of the preeminent dental law firms devoted to dental entrepreneurs. In addition to the law firm, he founded HR for Health, which is the leader in providing web-based human resources solutions and advice for dentists, ensuring HR compliance for dental practices, protecting them from employment law risks. Welcome, Ali.
Thank you.
We appreciate you being with us today. Could you just maybe start for a second and just tell us a little bit about HR for Health?
Absolutely, sure. So we created HR for Health a few years ago because what we saw was this epidemic at the time of a lot of our dentists at the law firm here being sued by their teams for these small HR issues that were turning into bigger HR problems. And so we wanted a solution that was all encompassing A to Z, from a time clock to an employment manual, from benefits tracking, And I'll tell you, Dr. Hess, it's been such a blessing because over the last many years, we have changed so many people's lives that have gone from having really stressful situations in the office on the HR side to really having the peace of mind of just knowing that now their HR is done. And I kind of joke that before we really got into this, people were just borrowing a friend's employment manual and they thought they had their entire HR figured out, and unfortunately, it caused a lot of pain and lawsuits and just a lot of stress. And right now during this whole COVID-19 epidemic, we really see the importance of our teams and the importance of having the right policies or whatnot. So we're going to go through a lot of stuff today, but that was the motivation behind creating it, was just to help the industry.
Well, thank you, Mr. Oromchian. We've been practicing. Thank you. Share your screen. What we'll do is, please, people, as you have questions come to mind, type them in the Q&A window. For those of you that are new to Zoom, you can change your views by moving your cursor into the upper right corner. You have a gallery view that you'll see the speaker and the panelist, or just the speaker view that you'll see the speaker and his PowerPoint presentation. So thank you. Look forward to what you have to say.
Thank you, and it's a pleasure to be here. And I want to start by saying that so much has changed. We were scheduled to do this last week, and we decided to push it back a week. And man, it was such a great decision, because now what you all will get is the latest information about what is happening with all these new rules, including the FFCRA, which is the Family First Coronavirus Act. We'll talk about the CARES Act and so many different things that have changed, including just as recently as last night and yesterday. So we'll go through all of that so you have the latest info. Of course, I have to warn you, things change so rapidly that what I'm saying today, right now, may not be necessarily all valid, although a lot of it will still be on Monday. And so we urge you to always stay on top of the webinars and the Facebook Lives that we do and all this other information. I'm going to give you a lot of resources at the end of today, including a really special gift that we just created for you all. So make sure you take advantage of that, and I'll give you more details as we get there. But I want to start with something that I think has become of real importance these past couple of weeks to over a month now, especially here in Washington, where many of you have kind of dealt with COVID-19 for a longer period of time than most of the nation, is that it's all about the little things in our lives that we sometimes take for granted. We worry about the big things, but then we forget about the little things. And if your experience in life is anything like mine, I think you'll agree, especially now, that it's always the little things that come back and haunt us. It's the little things that come back and bite us in the rear and prevent us from maybe accomplishing our goal. And what I've realized through what's happened with COVID-19 and all the laws that Congress has passed and that the president has signed, that it's all about the little things. And because they were in such a rush to pass these rules to save, to help employees and save businesses and kind of help them kind of navigate through this crisis, that a lot of those details that are so very important to all of us as business owners, those details are still being hashed out. They didn't think through all those things at the time. And so we're going to go through those details today, because they're going to be vital parts of what we need to focus on as we go from where we are today to getting ready to open up. Now, some of you have received your loans or have been approved for the PPP loans. We're going to talk about that, and there's some things that you need to do. For those of you who were not so fortunate and did not get the PPP loans yet, we're keeping our fingers crossed that the Congress and the president will pass further stimulus and allow more businesses to take advantage of it. But you're part of a larger group of millions of other businesses who unfortunately were not able to. And so we have strategies for you too that you can implement right now. Dr. Hess did a good job with my background. Just to give you a little bit more, I am married to a dentist. She's a pediatric dentist here in the Bay Area, and so I live your life. I'm not just a lawyer with thousands of clients nationwide, but I live your life every single day, because the things that she goes through and the things that I help her with and the things that are struggles are things that all of you are struggling with. So I get it and I understand, and it's a big part of why not only did we focus on dental when I opened the law firm, but we created HR for Health as a service. But then more importantly, the reason why we're doing so many of these webinars and seminars to reach a largest audience, because our goal is, with education and with that is the real power that you can have to navigate through this. And we're all going to be fine as we come out of this, but the question is, how do we do it strategically so that there's the least impact on our businesses, on our families, on our employees, and also on our patients, because that's really where everything matters. So let's start. We're going to talk a little bit about the FFCRA. That's the Families First Coronavirus Act. As many of you know, this is the law that got passed to really kind of set everything in motion to help employees to get them back on employment, and to focus on the businesses and to help them navigate this while the businesses are closed and open. So we're going to go through some of that, because still after even a couple of weeks, there's a lot of misinformation out there, and that's a big part of today. My goal is not to just give you information, right? You can find that almost anywhere, and there's a little bit of probably information overload as well, I'm sure. My goal is to give you context based on the information that you need to know. The reason is that context is really what matters, because that context you can use immediately in your businesses, in your life. So we're going to talk about that with the FFCRA. We're going to talk about the CARES Act, of course, and the loans and everything that comes with that, and some recent updates to that. We're going to go through a lot of that so you have the latest information. I'm sure this is going to create a lot of questions, so please, as Dr. Hess said, there's a Q&A at the bottom there. Put in your questions, and if you feel like I haven't answered them, then at the end we'll go through some of this. Then we're going to talk about strategies that you should be implementing, whether you got the loans or you didn't get the loans, strategies to get ready to open up. We'll talk about some of that, and then some exclusive resources just for AGD members that we'll make available to you, at the end. So let's jump into this. So let's start with some background very quickly. So as most of you know, this week was a very momentous week, because it was really the first time that the states started to really talk about opening up again. And whether that's right or not, we have to trust our leaders at the state level to really help us kind of get through this. Now, the governor of California came out on Tuesday and made an announcement that he was going to talk about how to open up the state, and that he was coordinating his efforts with the state of Washington and the state of Oregon so that they could team up and really come up with a plan. So we were expecting there to be some news about a date. Well, that didn't happen. What he came out and said, in essence, and it was echoed later by Washington and Oregon too, was that they were going to use a six criteria to make the decision of when to open up. Now his goal, I believe, based on some of the information that he provided there, and the fact that he said he's going to maybe give a date next week, as that trio kind of decides what to do on the West Coast, is that maybe it's going to be middle of May, maybe later on in May. We don't know yet, but they were going to maybe give us some dates, because the curve apparently is flattening. But as part of his speech, one of the most important aspects of it had nothing to do with dates of opening. In fact, he gave a 6-piece criteria of how, what the states were going to look at, Washington, Oregon, California, were going to look at as they decide what to do next. And the one that matters to us the most for every dental practice was number 5. Because what did number 5 say? Number 5 was talking about redrawing floor plans in businesses, schools, and other institutions to help with the COVID-19 epidemic and how to continue the minimizing the spread. Why is this important? Well, he used examples of restaurants, he used examples of other businesses, but you can imagine how this may really translate to a dental practice, right? Putting plexiglass potentially in the front office, you know, between the reception and the patients, putting maybe plexiglass in between operatories if you have a more of an open bay environment, you know, figuring out how many patients come in or how many guests come in with a patient, and do they actually sit in the waiting room or do they sit in the cars? There is major change coming with potentially how we operate our dental practices. And to add to that, OSHA is obligated by law under the FFCRA to give us an update probably next week, but they have until almost the end of the month to basically tell us what new rules businesses, including in healthcare, have to implement to help with the containment of the virus. Now, they're going to be doing this with the CDC, so we are expecting major changes to potentially come down on top of all the rules that you're currently abiding by. I bring this up for two reasons. One, I think it's important to keep an eye out for that. Once that comes out, we will be doing either Facebook Lives or other webinars about this very topic. So I'm sure, you know, we'll share all of that with you, and we'll make sure Valerie and everyone has it. But more importantly, what it means is that there may be great costs that you have to endure to make your office compliant before it opens up again. And with that in mind, it's important to really start thinking about your cash flow and really start thinking about the cash on hand. We're going to talk a little bit more about it later, but if you have to do structural changes, if you have to do some of those things, then there are things that you need to be aware of as you plan. So as you get more information and as people come to you, you know, selling products and equipment and those kind of things, I think it's great to do your research, to hold on to a lot of that info, but also to kind of sit tight and not spend until we know what the full dynamic of this epidemic will result in changes in your office. Then you can budget and plan accordingly from there. So keep that in mind, because these changes are going to come down, you know, hopefully by the end of the month, so well before we open up, but they are probably going to be pretty drastic. So now with emergency sick leave under the FFCRA, one of the questions we still get frequently is, what do I do about my employees? Are they entitled to emergency sick leave? Are they entitled to emergency FMLA? And what the Department of Labor has clarified now is that although those rules do apply to your employees, they can only go into effect. In other words, the employees can only use them and take those leaves once the office opens up for business and you're ready to see patients. So if you're only seeing emergency patients and it's just you and maybe one assistant and maybe it's one patient or a couple patients a day, that's not you being open for business. So your employees cannot use emergency sick leave or emergency FMLE at this point in time. But when you open up, even if it's like a partial schedule, or you open up and you're bringing back only a partial group of your employees, then they can use the sick leave if they fit in one of those 6 criteria. They can use FMLE if they also fit in that criteria with a child under 18 who's home because of school. So I won't go into necessarily all the details of it, but what I want you to know, because there is a lot of stress around this because it is a lot of money, is that this money is reimbursed to you through your quarterly payroll taxes. So if you open up and you end up having an employee or two who take emergency sick leave, and you do have to pay them, but in that quarter's tax returns, when you file it through your payroll company, you will get a dollar for dollar credit. That's pretty good. That's pretty good. So the stress is more of a cash flow conversation, less so than actually money's out of your pocket. So it's very important for you to keep that in mind. Okay, so we're going to redraw floor plans potentially, as we talked about. So be ready for potentially some of that. They may ask for plexiglass and other changes. We don't know yet, but we will know more soon. Unemployment benefits, as many of you know, the federal government is providing $600 to employees who are on unemployment, and they have offered this to all the states. Not all the states have accepted the federal government's terms yet. So Washington, I believe, has, and so we will, or your employees should be, if they haven't already been receiving this. I think this week was probably the first week that many people got that $600. If they haven't yet, it may end up being sort of next week. But this money is coming. It's on top of what they get from your state unemployment. And so it's a pretty good sizable amount. It's probably not as much as they were making while working for you, but it is a good sizable amount. And some of the questions we get is, well, what do I do now? Right? What do I do now if my employees do not want to return to work as we prepare to open up because they're getting so much from unemployment? And that is true. We are starting to hear that and see that. Our advice is to tread very kind of softly on these points, is to continue communicating with the employees. Now, if your communications don't resolve the issue and the employee doesn't come back and you are open for business, you can technically terminate the employee. Okay, but I never want you to do this on your own. So at the end of today, you're going to have my phone number. You're going to get our email address. I'm going to encourage you, if you need to terminate anyone as a result of this scenario, just call my office. We'll do a free consult with you and just kind of talk through it so that you make the right decision. Don't feel like you're on an island by yourself and you don't know what to do. Just reach out. I'd rather you do it safely. So be aware of that from an unemployment perspective, that if you're open and they're refusing to come back, depending on some other scenarios that we'll talk about, if you need to really let them go, you might be able to. The ideal scenario would be that you work through it with them, and if they have stress, because the things we're hearing now is, I'm taking care of a parent who's elderly, and so I don't want to risk getting the virus at the office, or they may be a single parent and they don't have childcare because school is still out. There's a number of reasons, and so we need to kind of talk through that a little bit. Now, before I get into sort of the screening of the patients or whatnot, one of the things I do want to talk to you about is we're going to talk in the next slides about exemptions, and so we're going to spend a lot of time about the exemptions of dental practices and things of that nature, so that we're all on the same page, because I've seen a lot of information out there and we have up-to-date info from Washington. So we'll go through that in a second, because I know a lot of you have questions about that. Now, with regard to screening patients or whatnot, every patient that comes through the office should be screened. And what I mean by that is that they're, sorry, I don't know what happened there. Their temperature needs to be taken, and that includes your employees. And so just make sure that you are doing that. And if anybody has any symptoms whatsoever, you send them home. Now, here's what the EEOC has been saying, and the Department of Labor has been saying about this. Typically, you can't ask about someone's medical conditions, right? You can't be testing them before they walk in and things of that nature. But these are not typical times. So what the EEOC has said nationally is a yes. If you follow the rules that the CDC and other healthcare professionals have set forward regarding how to detect COVID-19, you can take those steps to protect your other employees, your patients, and your business. So what does that mean? That means you can take temperatures upon entry. If somebody does show a temperature, we're using, if they're over 100, then you need to log it in either your workers' comp worksheets, or if you're on HR for Health, log it into their system, because you need to have a log of their temperature readings if they're 100 or above. That's our recommendation. Some are doing it from just even slight changes, but I think 100 and above is the CDC requirement. I think it's like 100.4 to be exact. But anyhow, so you do take their temperature. You can have conversations about symptoms. Now, what the CDC has said is you want to have conversations regarding symptoms that they and other healthcare professionals have said is associated with COVID-19. So what does that mean? Fever, obviously, cough, nausea, diarrhea, vomiting. Those are totally legit, and you can absolutely ask about them. Other things, not so much, right? So anything that is outside of the realm of potentially being a COVID-19 issue, they are recommending that you stay away from. But anything that is a symptom that has been regarded by healthcare professionals and the CDC, you can ask for that. Now, what you need to do with the information that you get from them is you need to store those in your medical files, which if you're doing things the old-fashioned way, which we don't recommend anymore, but if you're doing things the real old-fashioned way, you should have paper files, and you should have regular files, and then you should have medical files that are separated from one another, through a locked mechanism. But if you're doing things electronically through HR for Health or otherwise, what you need to really do is you need to store that information, and it's already kind of separated in the system, but you need to store that information because that is crucial for their files, and that is okay. That is absolutely okay, right? So just kind of make sure to have that. Now, if you go the extra length of ensuring that, or you're taking the daily temperature of all of your employees, which we are recommending, if you do take the temperature of all of your employees that come in, then please log those. But some people are just logging anybody who's above 100, and that's fine as well. Okay, that's fine as well. Now, if you find someone that has a temperature, one question we're getting frequently is, can I report them? Right? Can I tell some public agency about it? And the answer is yes. You're allowed to notify a public health agency if one of your employees has COVID-19. Okay, so not a patient, but an employee. And that is okay and acceptable right now. They're not going to get in trouble. They're not going to go to jail or anything like that. You're doing a public benefit. And so if you choose to notify them, the law protects you. Of course, under normal circumstances, you would never be able to disclose that information about someone's health concerns to a public agency. But because of the drastic nature of COVID-19, they have allowed this to occur. Another frequent question we get is, what if I have a pregnant employee? What if I have an older employee? Can I prevent them from coming to the office on our start date? Can I delay it? Can I do anything to change their job offer, if you will? And the answer to that is no. Okay, you cannot do that. Just because they're older, 65 or above, or they're pregnant, or they have a pre-existing health condition, just that fact is not enough for you to either withdraw a job offer or to delay their start. Now, some of you might say, why are we talking about job offers? These are all my current employees. That is true, but if you have terminated your employees, as many of you may have done, instead of furloughing them, if you've terminated them, then you need to hire them all back on. And that means going through all the new hire forms, having them sign the employment manuals, going through that whole process for every single person. So it is you have to give them a job offer with their, with their salaries and their benefits and all of those things. So you can't delay that. Now, my recommendation, of course, is that you want to communicate really well with your team to make sure that they know, and have this conversation with those that are 65 or pregnant or have underlying health concerns, and see what they want to do. They may not want to come in themselves. So instead of making assumptions or whatnot, I highly recommend you open some dialogue and you might be able to avoid some major issues that way. So so again, really great plans of attack here, because communication can resolve a lot of this. Now, the other thing that the EEOC and the Department of Labor wants you to have is updated anti-harassment policies in your employment manuals or standalone policies. If you don't have those, please make sure you get them. This is the time. Unfortunately, COVID-19 is the time for HR compliance, and so make sure you are absolutely on top of that. Again, if you need help, we can definitely talk about that some more. Now, if your employees or someone comes in and they're sick, and you send them home and they've been maybe in the office, you absolutely need to disinfect and clean the workspaces. That is all areas: offices, bathrooms, common areas, shared electronics, all of that. We got a question yesterday from a doctor that said, I have my employees just coming in one at a time, and one of them got diagnosed with having the virus. Do I have to do anything different? And the answer is yes. First of all, that person should not be let back into the office if they've been diagnosed. But more importantly, the whole entire office needs to be disinfected and cleaned now, because as we all know, now COVID-19 can rest on hard surfaces and can be transmitted. So it's just very important to take those steps. All right. Okay, so now let's talk about the exemption. A lot of you have heard about this. And so I have some good news and some bad news. The bad news first, so that we can focus on the good news. So the bad news is that we got word yesterday from some lobbyists who work directly with state associations and other associations, but state dental associations. And this lobbyist got in touch with someone at the Department of Labor, and they heard back that that dentists are not excluded or not exempted under the old definition, or let me rephrase that, are not exempted from the new definition of the FMLE that was passed under the FFCRA. So to give you a quick background, under the old rules of the FMLA, dentists were excluded, not their teams, right? So not hygienists and RDAs and DAs, they were not, but dentists themselves were excluded from those rules. We believed that that was the same when the new emergency FMLE was passed, because they didn't necessarily reference it directly. But now we've got word that dentists are not excluded. So what that means is that if you have associates, dental associates, they can apply for emergency sick leave and emergency family leave, as well as the rest of your team. Okay, so this is a new thing. So you have to know, this is very important, as this information came out just a few days ago. So dentists are not exempted in that sense. So very important for you to know that, because that is now clear. Now, but the good news is that there are exemptions that you can fit under, and here they are. So if you have less than 50 employees and you fit into one of these three categories, right? So first is that your expenses outpace your revenue, which many of you would say, well, of course, I have no revenue coming in right now, my expenses are higher. But this is really when you open your doors, right? So if you open your doors for business and your expenses still are higher than your revenue, and this causes you to not be able to be open even on a minimal capacity, that's very key. Your expenses have to exceed your revenue, but also you can't be open at a minimal capacity, then that's an exemption you can fall under, okay? Probably hard for dentists to fall under this, because we don't really know what minimal capacity means. Does that mean that it's just you and an RDA and that's enough? Is it you and an RDA and a receptionist? Is that enough? Is that minimal? I mean, we just don't really know. We've talked to thousands and thousands of dentists. Only a handful, I believe, really truly could fall under this. But again, that is available. The next one is probably a much broader and probably more useful for us. What the second exemption says is that if you have team members that have specialized skills, right? a hygienist, an RDA, someone, and that person not coming in would cause the business substantial risk and concern, financially or otherwise, then that's an exemption you can use. So that could be useful for us, absolutely useful for us. The third one is if you just don't have enough workers. Now, Washington has been hit harder than most states. And so as a result of that, you may have a lot of nervous employees. And your employees may not want to come back. You know, you guys have all seen on social media all the information about hygienists and dentists being at the highest risk levels for aerosol and droplets and whatnot. And so there may be true fear out there. If your employees not coming back causes you to not be able to be open, even minimally, because everybody was wanting to stay home, then you can exempt yourself as well, okay? So one, you have to fit into being less than 50 employees, and then one of these three. Now, who makes this decision? Well, you make this decision. An officer of the business or of the corporation or LLC, depending on what state you're in, has to make this determination. And so you don't file it anywhere, you don't do anything, but you file it under, you know, you make the decision based on this information. So again, you know, do this carefully. Make sure you're focusing on this as you're, you know, as to the facts. Try to keep it, you know, factually based in terms of your decision making. And if you need assistance, then we can definitely talk about it. But these three exemptions are exemptions to the FFCRA. So if you fit under one of these on an individualized basis for the employees, you may not have to give them access to emergency sick leave or emergency FMLE. Now remember, it's not an end of the world if you do, because remember, you get that money back. But there may be business and operational reasons why you cannot, okay? All right, so now let's go to some potential risks, things that we've seen across the country, you know, with our 6,000 law firm clients, and I want to go through them with you so that we don't make some of these mistakes. So one is terminating employees who are in a protected class. So you have to be very careful about this because it's human nature to want to terminate maybe employees who are not A performers, and that could, that decision is a business decision. It's not a legal one, it's a business decision. What you just have to be careful of is that they don't fit into some protected class that could get you in trouble. So what we have seen is, you know, if you're keeping your entire team, but you happen to terminate your elderly employees only, or maybe the ones that are pregnant or recently injured or whatnot, those could cause you problems. And so you have to be strategic about it if you are trying to, you know, let go of someone. So make sure you talk to, you know, us or an HR, you know, an HR lawyer, you know, just to kind of walk through it. You don't want to call your payroll companies HR people. You don't want to call even HR companies because this is really more of a legal conversation, but make sure you do that. The other thing is that we have seen pockets of dentists around the country teaming up to then try to set their fees in their communities. Now, antitrust is usually not an issue in dentistry. Everyone sets their own fees and does their own things. But I think because of this epidemic, people are trying to figure out how to open up again and how to do it strategically. So just be careful. The law prevents you from coming together as a group and setting fees to the detriment of the public. And so that's not allowed. There are ways of coordinating efforts that are legal, and those, you know, can be discussed or whatnot, but doing it as a community or as a study group or any of those things needs to be very carefully analyzed. The government has actually, as part of these bills that they've recently passed, have actually created a task force for antitrust violations, not just for dentistry, of course, but they have created a task force because they believe that this is going to be an epidemic or an issue around the country, and they are trying to resolve it. So just be careful about that. This is the time to get all of your HR documents in order. you know, a lot of us, you know, when we're in the heyday of our businesses and, you know, we're seeing patients all day long and dealing with staff and doing all the other things, it's hard to focus on HR compliance, but this is the time. I mean, if there was ever a time when HR had its spotlight, sadly, this is it, because this is a time to get your employment manual, to get your employee documents. If you have fired your employees, you need to bring them back and rehire them. You don't want to do this in paper, of course, anymore. So do it electronically through a system, you know, like HR for Health or whatnot, so that you can actually do it quickly and efficiently and get ready for when you're opening up your doors, because that is valid. Okay. Now, what most of you know is that yesterday was the last day. Actually, I think late Wednesday night was the last day for the PPP loan, because it ran out of money. And you know, we had actually projected it to be Friday or Monday, but they ran out sooner than expected. So many of you did not get these loans. Some of you were blessed enough to have gotten them through your local banks or whatnot. So we're going to talk about some of those strategies. You know, we do think that the government's going to pass a second stimulus on this front, but there's no guarantees, of course. So we'll talk about it. Now, here's what you should do if you did get a loan. Okay, if you got your SBA number and it's going to fund in the next, you know, 10 days or so, then I highly recommend you set up a new bank account. Okay, set up a brand new account so that the monies can be funneled into that and only in that bank account, so that you can keep track of your expenses. Remember, with the PPP loan, you have very specific reasons or specific uses for that money if you want it forgiven. And so you got to keep track of it. So by separating it, it's just going to be clearer accounting for you and the bank when the time comes. Now, we also are recommending that you separate your accounts. Okay, separate your accounts. So what does that mean? What we're talking about in terms of separation is that I highly recommend that you have one bank that you keep all your deposits, and then have one bank for all your loans and your debts. Okay, you might have to open up a small bank account with them, but keep your cash, you know, and your assets separate from your loans. The reason is that what we've seen right now, I mean, right now, this is not, you know, last year, 3 months ago, no, right now, as dentists are falling behind on their payments, what banks are doing is they're reaching in and taking cash from other accounts that are in that bank. So which is impacting the business in different ways. They're not asking for permission, they're just going in and doing it, you know, if someone misses a payment or two. So be very careful, be very careful. Keep your bank accounts with your assets in one institution and keep your loans with another institution, so that, you know, there's no cross contamination, if you will, of that. Okay, really important. Later on, when things get back to normal, if you want to kind of combine them again, that's not an issue, but that's a really great strategy. The other thing is that it's important now, if you haven't already, to start analyzing your expenses. So what do I mean by that is, do a very quick analysis, if you haven't done one already with your CPA, of figuring out what is your burn rate. What do I mean by burn rate? What are your fixed expenses? Those things that you actually have to pay in the next 30, 60, 90 days. Okay, so it might be rent, you know, it might be, you know, some A players that you still have on your staff that you're paying to call patients and things of that nature, utilities, some things that you haven't been able to get deferred, like maybe you got your loans deferred, don't include that. But the things that you cannot get away from, put those in there, and then figure out how much cash you have, and then see how long that will last. The reason is that this is an important analysis to do based on the, you know, for the reasons that we mentioned earlier. You may end up having significant costs soon with the renovations that we were talking about, the plexiglass and all of those things, the PPE stuff that you need to potentially buy for your office if you don't have them, and maybe even other equipments from the manufacturers. You may need to buy stuff, so you need to kind of figure out where your money is, right? And you have this PPP loan, but remember this, and I know a lot of you want to get it all forgiven. I don't blame you, right? I don't blame you. But remember, the PPP loan was not meant to save businesses. No, no. The PPP loan was meant to save jobs. So you have 8 weeks to spend it from the time you get it, right? But their goal, right, is not to save your business. Your goal was to save the jobs. And so as a result of that, you may not be able to use all of that to pay your employees if you're still in the shelter in place during that 8-week time frame. So if you have to use that money to do renovations and things of that nature, so be it. It's very cheap money and you can benefit from that and pay it in a couple of years. But without knowing your cash flow, it's almost impossible to make any of these strategic decisions. We highly recommend that you talk to your CPAs about this. If you don't have a good CPA who doesn't understand this and you want a referral, let me know. There are some really great dental CPAs around the country who do an amazing job and have volunteered their efforts to do some of this analysis and help you. But if you do have a great CPA, go back to them and say, help me through this. Okay, it's very important. Now, if you did not get the loan, right? If you did not get the loan, here are some strategies that you can implement for cash flow. Okay, one is that many of you are seeing the stock market drop and you are thinking about selling everything and going to cash. You could do that. I'm not necessarily advising it. You could do that. I'm not a stock expert, so you want to make sure you talk to your advisors. But one thing I want to tell you is that you can get something called a securities line of credit against your stocks and bonds. So what does that mean? It means that you can actually get a loan with very cheap money against your portfolio without having to sell it, which is potentially really good because the market has fallen. So that may be something to increase your cash flow. Your insurance policies may have a labor stoppage clause in there, where if your labor has stopped, which it has for all of us, then you can file under your insurance policy and potentially get some money. So take a look at your general liability insurance and whatnot. Call your brokers, walk through it, review it yourself. That might be something that's available to you. As we mentioned, do your cash flow analysis with your CPA. If some of you have whole life insurance policies, you can't do this with term life, but if you have whole life, then you may have been putting a significant amount of money away and there may be good cash values. You can take a loan against that whole life policy. So go talk to your insurance broker about that as well. That might be something that you can use to increase cash flow. Now, some of the things that applies to sort of everyone. There are things you can cut. There's things we're not recommending you cut. We definitely don't recommend you cut your A players, A employees. Make sure you don't cut them because they're going to be valuable to you when you open it up. Don't cut your HR. This is time that HR thrives, so make sure you're focusing on your HR. Marketing, especially in-house marketing with your own patients. If you don't want to reach out right now, that's totally understandable. But with your own in-house patients, make sure you're marketing to them. You can cut your 401k profit sharing for the year, most likely. Most policies allow that, especially under the circumstances. So if you need some cash flow assistance, make sure you talk to your broker. They may not be a fan of this, but it's probably a vital thing for you from a cash flow perspective. All right, okay. So let's end as we go into the Q&A. I see a lot of questions already, so that's great. Here are some resources for you so that you can kind of reach out and download some of this information for your benefit. So if you want to learn more about HR for Health, please go to this website and fill out a form. Somebody one of our team members will call you and do an assessment just to kind of see how you're doing from an HR perspective and give you some strategies there. No strings attached. If you want to at that point use their services, you certainly can. If there's anything from a legal perspective that you need help on, here's my law firm website. You're going to have my information in the next slide. But if you need anything, a lot of people are asking us about estate plans right now because of obviously the health concerns, and they have a lot of time on their hands. If you have a lease coming up, this is a great time to negotiate with your landlord. So let us know because you can get some really amazing terms and things of that nature. And of course, if there's any other legal issues, let us know. Now, here's some exclusive content for you. If you text the word PPP okay? PPPCALC to that phone number, 44222. You will get a calculator that we created, okay, to figure out how much of your PPP loan is going to get forgiven. Okay, it's a self-driven Excel spreadsheet, so that you plug in your numbers, very easy to understand, and then you do it. Now, I've put a lot of disclosures in there because I want you to take this and work with your CPA to figure out, and your lender to figure out the exact dollar amount of the forgiveness. But this will give you a running start on how to do the calculations. And so, because remember, it's very important to figure this out now so that you can plan ahead. Remember, one of the things that the PPP has done that's not being discussed really is that if you have fired employees and you don't have as many now than you did then, when those 8 weeks start, a big portion of your loan may not be forgiven. But they gave you a get out of jail free card. You can bring back those employees by June 30th and be okay. So this will help you plan for that. Okay, again, it's one word, no space, PPPCALC, and then the phone number is 44222. Okay. All right, and then I know you guys love information. We have a special resources page that we update all the time. It's got sample forms to patients, sample forms for your team. It's got, if somebody needs leave, you can fill, we have special forms we've created for that. These are all free to you, no strings attached. You don't have to be an HR for Health customer. We're just kind of giving it for free to all of our customers. If you are HR for Health, it's all in the system, of course. But if you guys need this information, please go to that website and you will get everything you need. And we update it constantly with content, very specific content. Okay. All right. Here's my office phone number. The email from my assistant if you guys want to set up a time to chat about any of these issues. I see, Dr. Hess, we've got a bunch of Q&As, so we can go through them now if you'd like, and go from there. So thank you.
Absolutely. Thank you very much. Very, very informative. We'll just we'll beat away at these questions here. We've got 28 of them. So you probably can't answer this, but where do we order PPE? All dental supply companies have stopped selling PPE.
Yeah, so that's a $1 million question. This is where your local reps really can show their value. Some of this is out of their hands, of course, but right now this is a question that is being asked nationwide. All the distributors, whether it's Patterson or Shine or the smaller ones, are having trouble with these. But I would say stay in contact with your local rep and order only what you need, of course, because there is a great shortage. What I would tell you is be careful of the things you buy from sources that are not legitimate, and that may seem like it's too good to be true. We have seen a lot of black market type stuff coming in that is probably not going to do the job. And this doesn't mean that you don't go to maybe a small distributor. There's a lot of great small dental distributors as well who may be able to help you, but there are a lot of black market stuff that's being advertised and sold and by third parties that no one's ever heard of. So just stay true to the bigger companies or to the companies you've been using. But yeah, that's the $1 million question.
Yeah. The question is, how much is it for a dentist to become a member? I'm guessing they're asking to get your services.
Sure. Our team can kind of give you the pricing. It just kind of depends on which of the products you use, but it's roughly about $225 a month for the sort of the entire system, and that includes updated manuals every year and a bunch of other obviously things. So we can if you go onto the website, somebody will give you all the details.
Beautiful. That ballparks it for us nicely.
Yeah.
Isn't Washington an at-will employment state? What negative consequences would result by terminating an employee?
Yeah, great question. So almost every state is an at-will state, but because of the way Washington's courts have ruled, along with a lot of the courts on the West Coast that are part of the Ninth Circuit, the rules have really stripped away from this whole talk of at-will. So the reality is that even though technically it's at-will, there's a lot of exceptions that make it very difficult to terminating employees who are in protected classes. At this point in time, because of COVID-19, a lot of people may have already terminated employees, and that in of itself right now is not necessarily a liability because of the shelter in places. The problems come in right now when you're trying to hire people back and you don't hire, everyone, and you discriminate, because these rules are, the anti-discrimination rules are not just in termination, but also in hiring as well. If you haven't terminated anyone, you furloughed them, then you're in a much stronger position.
If we detect an employee with a fever or symptoms, are we obligated to pay for them to go get tested, such as via L&I, or does a new act cover something like this?
Yeah, great question. So you're not obligated to pay them to go get tested. What we're recommending is that you pay them for half the day that they came in the morning, even if they just showed up and they tested positive and you sent them away. We recommend that you pay for half of that day, but or if you want to be generous, just pay them for the whole day, and then send them to get tested and provide documentation. But that whole process you don't have to do. And the new laws, give access to people where they don't have to pay for the tests and whatnot, but not doesn't give anything for the employers. So.
I guess the answer to this would be, yes, because do you have an HR manual we can buy? Can you review our HR manual and edit? And I guess they would go to your website and get hooked up with your employees or staff.
Yes, exactly. Yeah, for this, Dr. Yazadi, go ahead and contact me at the front desk email. What we can do is we can take a look at the current manual. If it can be revised and you don't have to get a new one, then we'll probably recommend that. But if it's more than 3-4 years old, we would say just get a new one, because the effort to get a new one will be easier than revising an old one, because so many laws have changed, not just because of COVID-19, although that has most recently happened, but in the last 3 years, there's been hundreds of changes, and so it might just be easier to do it that way.
Okay. I have an S corporation. I pay myself through paycheck. Can I apply for unemployment?
Yeah, good question. So yes, you can apply for unemployment as an employee of your own corporation, but I want to caution you, because state agencies kind of have a skeptical eye towards owners of businesses filing for unemployment. So make sure when you answer those questions, you absolutely answer them correctly and accurately. Don't dive into any of the gray areas. And the reason is because we do expect that, not in the immediate future, but in the next 18 months to 2 years, that there will be unemployment insurance audits, and you don't want to be on the receiving side of that, because they go after fraud and those kinds of things. So.
Along those lines, in Washington State, and the Braves dealt with this on Wednesday, that we'll be able to apply for unemployment on the 18th. And then we were supposed to use our SAW accounts, I think, if we have those with the unemployment office. Right. Okay, can we disinfect our masks either with high heat dryer or with our dental sterilization units?
I don't know. That's above my pay grade.
Okay. Thank you. My approved loan, which I have not received yet, only included my staff. Any possibility of reapplying to include myself?
Okay, so I'm not sure I understand this fully. If we're talking about the PPP loan, then that you can use for your staff, yourself, utilities, and other things. This doctor might be also referring to the EIDL loan, and if you got less than if you didn't include yourself, then you can probably reapply. They may not give it to you because you're already in the system. You know, it's only about, you know, it's probably just $1,000 extra. It may not be worth it to do that. So.
Okay, so are you saying that with the PPP, if you did not put your wages or your salary or compensation in there, you're probably not going to be able to reapply?
Well, yes. I mean, most likely, if the banks did it correctly when you applied, then your salary would have been in there up to $100,000. But we are telling everyone, if you got your loan, get the money, and then we'll figure out what to do with it. You know, once in that 8-week period. But if you don't take the money now, your application will go to the back of the line, and we already know the money's run out. So you probably won't get a second bite at the apple.
Okay, I'm guessing this is once we're back up and running for sick leave. Do we have to pay 2 full weeks of full pay for employees?
Yes, you do. And the definition of 2 weeks, though, is their typical 2 weeks. So, for example, if your employee worked 4 days a week, then it would be 32 hours times 2. So you would pay 64 hours, not the 80 hours that is the government's version of full-time.
Okay. I think you answered this during your presentation, but will you please go over the criteria for sick leave and the FMLE Act?
Sure. So there's a lot of information we have on our resources page about this, but here's the quick and dirty of it. So with regard to the FMLE, if an employee has a child who's under 18 years of age, and that child is home because schools are closed, and there is no other childcare available, so not a spouse or whatnot, or somebody else in the family, then that employee can file for FMLE. Now, they get paid 2/3 of their salary or their hourly for 12 weeks. The first 2 weeks is unpaid, but then the 10 weeks after that is paid at 2/3 their salary. Okay, so that's the FMLE. Now there's maximums and things of that nature, but we won't go through that. The sick leave, there's 6 criteria. The ones that you have to be aware of that are most relevant is if the employee is sick, has symptoms, is taking care of someone who's sick, has a child who is home from school. Any of those things would be sufficient for that person to also use emergency sick leave. Now, the one that almost everyone will fall under with emergency sick leave is the shelter in place. If the state has a shelter in place program in place, and that employee cannot work from home, so they can't telecommute or whatnot, then they can apply for emergency sick leave as well, and that is at their full rate. So.
I think this is a good follow-up to that. How about employee that does not want to work because they have kids out of school? Do I have to pay full pay or can I terminate them?
So if the employee doesn't want to work because they have kids out of school and there's no childcare available, no spouse or whatnot, and on top of that, they can't telecommute, in other words, they can't work from home, then they can use FMLE, as we mentioned, or they can use sick leave or both, and you'd have to pay them for that once you open up. If they have exhausted all of those things, or they don't qualify for any of those things, and they still refuse to come in, then you can terminate. But again, I highly recommend you contact me, or another HR type lawyer to talk about it before you terminate, because it's highly, highly risky. So we are seeing people right this second targeting dentists because we've already gotten letters from plaintiffs' lawyers who are saying, you terminated my employee, we're going to sue you for X, Y, and Z. So it's coming.
And along those lines, the kids get out of school, let's say the end of June. So July, August wouldn't be typically dates they would be in school. How does the act apply there?
Then they wouldn't qualify for it. Now, if they had like daycare or summer camp programs or things of that nature that also got canceled, then we think they could potentially that could potentially apply as well, although it's unclear right now. So
Can the employee decline to come in if they are on standby?
yes.
For employees that we ask to come back, do we have to rehire them with the same terms and wages that they originally had? I guess this is if you fired your employees, right?
Yes, yeah. So it depends on the scenario. What we would recommend is that if you're going to change their compensations and benefits because obviously revenue is down and expenses are up, that you do it across the board with every employee and not pick and choose. Because if you pick and choose, then there's potentially discrimination types of issues that come up.
This may be not in your pay grade, but aren't people contagious for 2 to 3 days before fever and other symptoms? Does temperature taking make sense?
Yeah, you're right. It is above my pay grade. This is just what the CDC recommends. I think you're right that the symptoms may actually start after somebody's already sick, but they want to catch it as soon as possible. So.
Let's see. Since dentists are required reporters for other public health concerns, are we now or will we be required to report patients who show with COVID symptoms?
So we have information about employees and you have the ability to report them. We haven't seen anything regarding patients and whether you're obligated to report them right now. That might be a very state-specific issue. So I would keep an eye out on the dental board in Washington and see if they come out with any recommendations. So that's sort of our general feeling. Now, some cities and localities are coming up with their own rules now as well. So I would kind of keep an eye out for that.
This is kind of a vague question. So if we have less than 50 employees, we are exempt?
No. You have to be less than 50 and fit into one of those 3 categories that we mentioned.
And so, okay, yeah, you answered that one. If a staff member is furloughed and becomes pregnant during the time, can they delay their returning and still get their UI benefits?
So yeah, they can definitely delay their return. They might get UI, but most likely they'll get, instead of unemployment, they might get disability.
Okay. If we're screening a patient on the phone and they are attempting to make a non-ER appointment and they report being positive, but argue they are asymptomatic, is there any legal ramification denying an appointment until medically cleared?
Yeah, Abby, great question. This is going to become an issue, absolutely, and it's already sort of out there. The answer to that is there may be legal issues, but you are covered because if it's your employees who this becomes an issue with, then it might become a workers' comp policy issue. But if it's a patient, like you said, then your general liability or your malpractice will kick in and protect you. That is why that's there. But yes, you shouldn't do anything different. You should still deny that patient the appointment because of everything we've learned today. But if it turns into a legal issue, then you'll have protection in place. So.
If one of my staff was diagnosed with COVID-19 during the shutdown, do I have to announce to patients or the other staff when we go back to work?
So, if they have not come into the office and had no interactions with the facilities, then no, and no, you do not need to tell the other employees either. But I would communicate with the staff member who is infected very closely to make sure you have clearances and everything else before they return to the office. If they have had interactions with the office during the shutdown, let's say on an emergency, with an emergency patient or whatnot, and you would need to notify everybody who came in that day, including employees. So.
Okay. If we do get idle money, do you recommend we open a new bank account and move the SBA money to the new account?
Not just for idle, no.
Okay. But you did recommend that for PPP loan.
Yes.
Okay. Can idle money be used for medical insurance premiums of the doctor and business, reducing disability insurance and phone and internet for the office?
So the idle money is supposed to be used for the business, not necessarily for personal. So I would definitely not use it for disability insurance and things of that nature. If you use it for medical insurance for your team and you happen to be part of that group plan, that could probably be okay. But you know, utilities, phone, on the internet, that's probably fine. But make sure it's business related. When you filled out that form, you swore to the government that you would use it for business reasons. And so it's only $10,000. We don't expect there to be sort of audits or whatnot, but there could be, but just be careful.
What about reducing an employee's hours due to less business when we open again?
That's okay. That's okay.
Okay.
Just, again, I would reduce everyone's hours or base it on some sort of other metric like seniority or something else that's legitimate.
Okay. If I'm having a staff work 3 hours a week to make calls and such, and she is on standby unemployment, can I use her payroll from March 15th from the SBA idle? I'm not sure. You're reading that question, aren't you?
Yeah, I'm not sure. Yeah, I'm not sure exactly what's being asked either, but I think the question is, can I use the idle loan to pay my employee going back in time to March 15th? And the answer is yes. If you haven't paid them yet, you can use it for that.
Okay. If we're a startup started in January 2020, do you recommend for applying for any of these loans?
Oh my gosh, yes. I know how hard that must be for you. We have a lot of clients that are in your shoes that have opened up this year and are facing struggles. I think the PPP loan is probably not going to be as useful for you, but the idle loan could be helpful. What my recommendation is, though, apply for both because the rules are changing so frequently that you might be able to get it. The reason why I'm not as confident about the PPP as I am for the idle for you is because you have to use last year's average payroll. And so if you just open this year, it may not work, but work with your individual bank.
So can we use PPP funds for, say, renovations? This portion, of course, would not be forgiven, but is it still okay?
Yeah, great question, Jeff. Yeah, so what I would say, this is very bank specific. So I would say look at the promissory note that you're going to get from your bank to see if they have specific exclusions. Some banks are using their own documents and making additional rules to what the SBA is requiring. So it may not, you may not be allowed to. But under the SBA rules right now, as long as it's a business reason, we believe you can. Renovation, I'm not sure if that fits for a true business operational reason because it's more capital building there. But talk to your CPA to verify.
Okay. Is federal tax FICA forgivable with the PPP?
So anything that's included as part of compensation would fall under the forgiveness. So your portion of FICA that you're paying, state taxes and whatnot, should be included. Yeah. Again, work with your payroll company for the exact numbers.
Thoughts on applying for unemployment as an owner after 4/18/2020?
Yeah, I think the same thing we said before. You can apply, but just be careful, because of the skeptical eye.
Okay. Can I hire my 21-year-old daughter or office manager's 18-year-old son who did not previously work here if some employees can't come or won't come back?
So it gets kind of tricky. This is a very common question. It gets kind of tricky because remember, the banks are going to audit you to make sure that you're spending the money correctly. And if they notice that you're hiring your own family members and things of that nature, and there's not a good justification for it, then you may run afoul of some rules. So I would just be careful of that. I know the goal is to forgive as much as possible, but that may not be allowed unless they're truly providing services. Again, I would work with your lender on their specific rules because they're going to be the ones making the determination.
Okay, how would you mitigate potentially paying staff members 12 weeks, 2/3 of the pay, CARES Act, every time a COVID-19 flare-up occurs and schools shut down?
Yes, yes. Well, they only get, this rule is only for, this year. So it's only through December 31st. And once they exhaust the 12 weeks or any portion of the 12 weeks, they don't get any more. So if they use all of the 12 weeks once, then they don't get it again if it flares up.
Okay. This seems to be a statement. There might be a question in here somewhere. According to the SBA offices right now, that June 30th exemption is not true if the 8-week period is before that date. Therefore, the forgiveness is only based on those 8 weeks.
Yeah, that's right. The 8 weeks in terms of the forgiveness starts from the time the loan originates. So whatever your date is, it might be today, it might be tomorrow, next week. The 8 weeks that you have time to spend money for forgiveness is in those 8 weeks. But with regard to the employees, you have until the end of June to hire them back on. So of course, if your 8 weeks is closer to the end of those, to the end of June, then you have that maximum time. But if you need to rehire employees, you need to do them within your specific 8-week period.
Okay.
But the outside window of that 8 weeks is always going to be June 30th right now.
Much of our team is not receiving unemployment. Is there any way to check on why from an employer view?
Yeah, no, great question, Julie. I have no idea. This is the oddest thing. We have had doctors nationwide. I mean, we're talking, the law firm has 6,000 clients. HR for Health has many thousands of clients as well. And seems like it's completely random. Some offices, everybody gets unemployment, and some offices, suddenly no one gets unemployment. And we haven't been able to figure out why, if it's something that the doctor is doing in their application or the employees are doing in their applications. We have no idea. And as you know, you can't get a hold of anybody at unemployment. So there's no clear answers. So.
Okay. Somebody again asking for the address to obtain employee documents. I think you've got your email up there.
Yes, and if you go to, let's see, let me see if I can bring this up. Oops. There we go.
Beautiful. Thank you very much for doing that.
Mm-hmm.
My wife works for me and has a W-2. However, we excluded her in quarterly UI as an officer. Can she still apply for UI?
Good question. I'm not sure. I would talk to your payroll company. If she can probably still apply for UI, but they may limit how much she gets.
If a team member is a high-risk patient and does not want to come to work, do I still have to pay her FMLA, or is she considered unemployed as she elected not to work?
So she only gets FMLA or sick leave if she fits into those categories that we previously discussed. But if she refuses and she doesn't fit in those categories, then you might be able to terminate her.
Okay. This is from Dr. Bataro. Please clarify about standby employees. Can they decline to come into work?
Yes.
Okay. You've answered that. Can we self-exempt because of a shortage of skilled labor hygienists in our area? The temp agencies can verify this shortage of skilled labor.
Yeah, so the exemption is for your current employees. And so if your current employees are refusing to come to work, then you can, in terms of skilled hygienists, then you can exempt yourself, but not just because there's a shortage of qualified hygienists in the area.
Since EIDL and PPP cannot be used for the same purpose, can you define this? Is this generalized, like can only use one for payroll, or does that mean not for the same time period?
Yeah, that's right. It can't be for the same, in essence, it can't be for the same time period, and because they don't want you to double dip. So.
This is a good question. If I did not get an EIDL or PPP loan, can I apply for a tax write-off if I'm using savings for current overheads like payroll, rent, medical insurance? I guess that's like self-funding PPP program.
Yeah, that's right. Yeah, so you can, what you're doing here is that there's a couple of things here. I mean, this is definitely a CPA question, but since I have my master's in tax, I can give you a little bit of a runway before you talk to your CPA. So there's two things happening. When you loan money from yourself to your business, then that's a loan to your business. The business gets the cash and then uses it for these expenses, and then can expense those off of its tax returns. But then the business will have to repay the loan to you. So that's one side of it. But the question you didn't ask that I think you wanted to ask, which I think is great, is the fact that if you don't get PPP or EIDL, there are a ton of other tax opportunities that the IRS, I'm sorry, not the IRS, the government has allowed you to take. So I would talk to your CPA, and if you don't get those loans, use those other things, because you can get $5,000 per employee as a tax credit. I mean, there's a number of other great things that were in the law. So you can definitely use those.
Okay. Is an independent contractor who is the sole employee eligible for PPP, unemployment, or both?
None. No.
Okay. Okay, an employee declined to come in. They are on standby. Do we fire them? I thought standby meant they have to be available for work and they get an extra $600 per week and they don't have to look for work.
So if an employee declines to come in and they're still quote unquote employed, the unemployment agency, if they find that out, will probably deny them because they, if the office is open and they're just not coming in, then they're declining work. If they have a good reason or there's not enough work, then they could potentially get it. Or if you fire them, then they definitely can get unemployment.
Okay. Yeah, I think it's really dicey, isn't it, right now? Because the offices were mandated to be out till May 18th right now. And then we have the stay-at-home order till May 4th for the majority of people. So yeah, that's tricky, isn't it?
It's very tricky, yeah. And no one's giving unemployment really any information, and they also are not available to give us information as a result. So.
Okay, can EIDL loan be used for payroll taxes and B&O taxes?
If they're if they're back owed taxes, yes, as long as they're business related. If they're personal, then no.
Okay, if I want to pay back my employees from March 15th, do they have to pay back the money they got from unemployment?
Probably not, but they will. Their unemployment will probably stop moving forward.
People just want to terminate people that don't come in on standby here. I think we've answered that a number of times. If we have not received EIDL grant and we know of others who had applied on the same day, does it mean that we got denied? Will they send you a denial email?
Yeah, I don't know. I have no idea. I think it's probably a good assumption, but the government's so slow right now, we don't know. So.
I have one of two hygienists who cannot come back and hard to hire here, but is that a good exemption for family leave? Sorry about that. I should have read through that.
No problem. I have one or two who cannot come back. So yes. So I think if you have two hygienists and they both do not come back, then you could fit under that second exemption where a highly skilled employee is refusing. So.
Okay. And the final question, and we're actually hearing this a lot.
Yeah.
What if I take the new requirements as my cue to retire? What help is there for me?
Yeah, no, I absolutely, Dr. Lasky, you are one of many, dentists who are making that decision. for a lot of reasons. I mean, one of it is, obviously the requirements, the expenses and whatnot that are, and the changes that are coming down. But the second is a much more real, reason, which is that, if you are retiring, then you may be in that group that is more susceptible to getting sick and maybe not, coming through it as well. And so why put yourself in that risk? If you reach out to me, I can definitely introduce you to some really strong brokers and also others who can help you find a buyer for your practice.
Well, thank you very much. You handled
My
all
pleasure.
those questions in 25 minutes. Wonderful.
Thank you.
So, Mr. Oromchian, thank you so much
My pleasure.
for joining us. We look forward to maybe hosting you in the future, and thank you for your support of the Washington Academy of General Dentistry and our membership. Is there anything else you want to add before I put up my screen with the upcoming CE events?
No, that's all, Dr. Hess. Thank you so much for having me, and I'm glad we got through all the questions. And of course, if anybody else has any other questions, I'm happy to answer those, and I would look forward to coming back as well. So I hope you all stay healthy and safe and get to spend some quality time with your families.
All right. Thank you, sir. Appreciate it.
Thank you.
All righty. And PowerPoint. And we're going to share our screen here. Come on, where's our PowerPoint? There we go. And this will show you upcoming webinars that we have here through the Washington Academy of General Dentistry Stay Home, Stay Healthy CE program. Again, we want to thank all our co-sponsors, Pierce County Dental Society. Thank you, Dr. Bataro. We'd like to thank Snohomish Dental Society. Thank you, Seattle King County Dental Society and Mrs. Mark Egbert for supporting us. Thank you to Comet USA, Patterson. Thank you to the Washington Academy of General Dentistry, to the Canadian Academy of Restorative Dentistry and Prosthodontics. Thank you to the Arkansas AGD, Texas AGD, and California AGD. I think that covers about all our sponsors. Again, this was a great webinar today. If you want to see this webinar again or the other webinars that we've hosted, please go to washingtonagd.org, and you can use the YouTube link there to access those webinars for a period of time. Your CE credit, if you are an AGD member, your CE credit will be credited by us. We'll submit to the AGD, and it should show up on your transcript in the next 2 to 4 weeks. You should receive an email in the next day or so with your CE credits for this webinar today. You will be receiving 1.5 hours of CE credit. There's kind of some misinformation going around that for webinars you receive half a credit. That is not true. For every hour or half hour of webinar, you get the full credit for that. We have our next speaker, Dr. Alan Yassin, is coming up at noon. So in half an hour with his implant study club. He has a guest on today, and that will be a 2-hour CE. Please, you can use the QR code to register for that on the flyer, or you can go to washingtonagd.org. Keep in mind, Dr. Yassin will also be doing the second implant study club on Monday. So make sure you get registered for both, and don't get confused to register for Monday when you actually want to register for today. So next week, we're packed full with CE again. We've got 8 webinars, I believe. There's some that are great there for team members. Michael Giardino is a grad perio student at the University of Washington. He's going to go through the updated AAP classifications of periodontal disease. So that one will be good for anybody that's doing coding in the office, or hygienists. and dentists to get up to speed. Remember, all the CE is coming to you free because of the Washington Academy of General Dentistry and our support of our co-sponsors. If you are not an AGD member, we highly recommend becoming an AGD member and taking advantage of the great low-cost CE and annual meetings that the Academy of General Dentistry puts on. So with that, I'd like to just say thank you for everybody that's joined us, and stay home, stay healthy, and please enjoy the CE. Take care. Thank you.
Bye, everyone.
All right, Val, you can take us out.
Great presentation. Thank you very much.
Oh, thank you, Gary. I appreciate that. Thank you. Yeah, it was a lot of fun.
Wonderful.
Thank you,
Thank
guys.
you very much for going through those questions. You
Yeah.
know, it's tough because, you know, as dentists, we're getting all this information and trying to absorb it. And, you know, your presentation was really well laid out. And I know a lot of the questions were kind of redundant, but, you know, it's very important for people to get their question answered, and appreciate you doing that.
Yeah, it's my pleasure.